Mr. Chairman, and thank you to Senator Sullivan for this, and thanks for coming back to us. We appreciate
Thank you for having me.
this. And, one of the things that Senator Tuberville and I have worked on is legislation we've introduced with the 3-year pilot program that would allow veterans to go directly into facilities in their community and really kind of take the referral process from VA out of this. It is frustrating to people. There are so many frustrations with how the VA is working and running the community care program. And in June, you indicated to us that the VA might propose changes to the current access standards, and because community care was costing too much. And in your recent report, which was late,
Yes, it was.
about 3 months late,
Yes,
you
ma'am.
stated that you would not propose immediate changes to the current access standards. So that's good, but however, what concerns me is that you go on to state that you're planning to incorporate VA telehealth into the access standard eligibility criteria. And the concern is that this might be a way that the VA would manipulate the numbers and prevent veterans from seeking care outside the VA. So if a veteran wants an in-person visit, but the VA can provide a telehealth visit within the wait time eligibility category, will that veteran be allowed access to an in-person visit in the community?
Yeah, thanks, Senator. No, I'm not aware of anybody who wants to manipulate the data or obfuscate anything. When we make a proposal on the inclusion of telehealth, we will make sure that we do this with plenty of time and transparency for public comment obviously from you, from veterans in Tennessee, from veterans across the country, and we'll obviously carefully consider those.
Telehealth can be a wonderful tool, but we do have veterans that prefer in person, and so that is of concern. Let's talk about the PACT Act, because we're very concerned about that. Now, one of the questions that has come to us is veterans have been receiving treatment from a provider in community care outside the VA. Will that veteran, will the VA force that veteran to then come into the VA to receive care if they're covered in that PACT Act addition, or are they going to allow them to stay with the provider where they've established that relationship?
There's nothing in the PACT Act that would force any changes in existing referrals and existing relationships with doctors. So I'm not sure I understand the question precisely, but
well, we've got some veterans who've chosen community care and they're there, but they're also going to be given additional services because of PACT Act, and what they're wanting to do is stay with what they have. Let me ask you something.
Well, they would obviously continue to work that out with their primary care provider in the VA, and they'd work that through their referral process and their relationship with their doc.
Let's talk about wait times, because why has the VA chosen not to calculate wait times based on the date of request as required by the Veterans Community Care Program regulation?
We haven't made that choice, so I'm not sure what you're referring to.
Okay, well, you all are...
For new patient appointments with a referral, the average wait time is calculated starting when the consult is entered by the provider to the date that the appointment is completed.
Okay.
Okay.
All right.
For a new patient without a referral, the average wait time starts with the earliest recorded date in the process of receiving care.
Okay.
For established patients, the calculation is made from the moment that veteran with his provider determine, hey, I'd like to have you come back in 6 months, or I'd like you to come back in 3 months. So that's the way we do it. I think you might be referring to the way the calculations were made on the website, which I've committed to the senator from Kansas the first time I appeared here. I would change because that happened before I got here. So if that's what you're referring to, that has changed as of July.
As of July. Okay, thank you. And I'll submit one to you for.
Thank you very much.
Thank you.